Hmm. Hello, everyone. Welcome to another review class for our students from lab. Today, we shall continue with our discussion on auricular medicine, and we shall be focusing on the points of the tragus or the tragus. So, we shall start with the Western or the European chart. So, I guess all of you are familiar where the tragus is. Okay. Okay. So let's start with the pineal gland. So this is the tragus. Okay, it is located on the, as you can see from the slide, it is located on the lower part of the tragus. And this is indicated for patients who are experiencing jet lag. So if you're considering traveling long flights, no, so you might want to use this point. And those with irregular sleep patterns and depression with insomnia. So try to remember that the pineal gland. Actually, dito din yan siya. It's like the intang, no? You can actually,
In
yes, the intang. Expert ka dyan, di ba, Sir Mark? So yun. Next, we have the mania point. Okay, it is located at the tip of the lower ear tubercle of the tragus, which is slightly below the nicotine point. So this is also interesting because um, usually kasi pag nagmamanic yung isang pasyente, uh, nag-grab ng cigarette. I don't know if that's true with some of you. Okay, if you have bipolar. Okay, so for those with manic disorder, manic hyperactive manic behavior, you might want to use this mania point. So it somehow tends to relax the patient, no? It's better than taking a downer. Okay? Na madidepress naman kung gagamit ka ng parati noon. And of course, the next one would be the nicotine point. So tatlo na. We have the pineal for jet lag and also irregular sleep and depression. We have the mania point. If you become aggressive, if we happen to be suffering from bipolar, then we have the nicotine point, which is at the tip of the lower ear tubercle of the tragus. So obviously, this is very good for curbing your cravings for nicotine. So for those who want to quit smoking, and we all know that we have another protocol to help, but I guess this is more specific for the craving, the nicotine. Next, we have the tranquilizer point. So dito magkatabi yung apat, no? So I think I would opt to use both the mania point and the tranquilizer. Do you agree, Sir Mark? Isabay na lang natin kasi mukhang pareho lang naman. So this is good for anxiety, no? And if your blood pressure shoots up because you are very anxious and you are suffering from a lot of chronic stress, no? Kaya wag kayo pa-apekto ng stress, papangit tayo lalo and we will get older, no? So, aside from giving us cancer. So, ito po yung tranquilizer point. I'm sure some of you might want to try this point. So, andyan na po yung ating pineal gland. We have the mania point, which is slightly below the nicotine point, no? So, nasa tragus lang siya. And also the tranquilizer point. Next is the corpus callosum. I believe all of you are familiar with the corpus callosum, yung nag-aral ng scalp acupuncture, di ba, Sir Mark? It connects the two lobes, right? Mm. So it's basically trying to connect the two lobes of the brain, right? So, kasi pag nag-disconnect yan, magkakaroon ka ng disorientation or you will have diminished consciousness. So it is located on the upper part of the tragus. It's good for for doing analysis, those doing comprehension. Okay, also for learning language, learning a new language, and especially when you're into composing. calculation, emotions, memories. Ang dami palang gamit nito. So, corpus callosum. Next, vitality point, which is just slightly above the corpus callosum, no? It's good for immune system disorders and for those with AIDS and cancer. Okay? Take note, full-blown na ito, ha? Hindi lang HIV. So you might want to use the vitality point. So with the goal of actually stimulating your immune cells. Kasi when you have HIV, when you have AIDS, you have more of the suppressor cells than the helper cells, no? Acting. So here we need to, of course, as much as possible, we should try, although ngayon madali nang matreat ang HIV, ang AIDS, so you might want to think of using this vitality point. Then we have the apex of the tragus. So the apex is here. So as you can see, hanapin mo yung notch above the tragus. It is very close to the helix. Okay? Yeah, actually, this is medyo sensitive dito, yung pasyente, especially if the patient comes to you with pain. Most of the patients naman who come to us are those with pain, no? Although we opt to use the sympathetic point or the brain point, you might want to use itong apex of the tragus. So usually malalaman mo yan kasi medyo sensitive siya dito. Next, okay, although the whole ear is the ear, meron din tayong external ear, no? So for those who are suffering from deafness, tinnitus, and ear infections. So probably this is to somehow protect the ear or prevent the ear from getting infected, no? External ear. Okay, now let's go to the Chinese, which is actually my favorite. So let's start with the thirst point. Ito po ang thirst point, ito yung external nose. Kanina we talked about the asan nga yung external ear, 'di ba? Andito po yung external ear, no? So somewhere here, okay? So if the external ear is here, so andito po yung ating external nose. Okay? And then we have the hunger point. Then kung may external nose, meron din tayong internal nose, which is number 24. So this is external nose, this is internal nose. So you might want to use that for those who are having issues with smell, olfaction. And then we have the adrenals for those who are under a lot of stress. Okay. So let's take up each point one by one. Okay, let's start with the thirst point. So as the name implies, it regulates your thirst, whether it is excessive or insufficient. No? So kung parati kang nauuhaw, you might want to use this point, which is very near the external ear point. No? Okay. So then this is commonly used in weight loss protocols so that you will reduce fluid consumption. And then we go to the external nose, number 22, especially when you have problems on the exterior of the nose. Okay, there are people na may acne sa ilong. You might want to also use this. Those na bago lang sinuntok, no? Broken blood vessels of the nose, or when you have rhinitis. Okay? And then we have the hunger point. So, itong tatlo na kahilera to. Hunger, internal nose, the adrenal. So yung pinakamalapit sa mukha, that would be your hunger point. Okay? So it can, depending on what technique you would like to use, of course, if you are not feeling if you don't have any appetite, you might want to stimulate it or tonify it. Pero pagkain ka na, parati kang gutom, especially when you have issues with your blood sugar, no? You might want to use this to sedate the hunger point. So this is also traditionally used as a part of a weight loss or stop smoking protocols. This will curb your cravings, okay? Nawawala yung ating ganang kumain or manigarilyo, okay? Then we have the internal nose, which is number 24. So we use this for runny nose, stuffy nose, sinusitis, when you have a bloody nose, okay? Or when you have epistaxis, okay? And then number 25 is the adrenal point. So we use this for treating shock, no? Usually kasi pag nag-lose ka a lot of blood, there will be no pulse, no? Okay, so there might be okay. Some people are so difficult to feel the pulses, so you might want to stimulate the adrenal point. You can also use this for asthma, hypotension, stress, infection, inflammation, trauma. It can regulate your adrenal hormones and it treats cough and shortness of breath, which is secondary to adrenal insufficiency. And you can use this for any disturbing sensations. So that's about it. I hope you enjoyed our lecture or so ang dami na nating points na tututunan. Next time we shall continue with the tongue. We will with the pulse naman. Are there any questions before we go?